Have you ever walked out of the bathroom thinking you were finally done, only to feel that nagging pressure return seconds later? That quiet whisper that says, you didn't empty properly. For millions of people, this isn't occasional. It becomes a daily frustration, stealing sleep, breaking focus, and quietly chipping away at confidence. Many men and women assume it's inevitable, something they must tolerate as they age. But here's the thing, it isn't inevitable, and often it's fixable with a simple 60-second routine. I'm Dr. Jocelyn, and over the past 5 years, I've helped men and women struggling silently with incomplete bladder emptying, nighttime urgency, and urinary frustration. I've seen how small, targeted changes can transform lives, helping people reclaim sleep, comfort, and dignity. Before we go any further, drop a comment below. Where are you watching from? I love seeing how far this conversation travels. Hit the like button if you're ready to take back control of your bladder. Subscribe and turn on notifications, because the techniques I share here are designed to protect your confidence, comfort, and independence. Now, let's unpack why this happens. When the bladder isn't emptying fully, it rarely arrives with one dramatic event. Instead, it shows up in persistent little annoyances. You finish urinating and seconds later feel the urge again. You wake 2 or 3 times at night, each visit yielding only a small amount. The stream starts and stops, leaving subtle dribbling behind. A low pressure feeling or sudden urge appears out of nowhere. There's a biological reason for this and an emotional impact. The bladder and pelvic floor are a coordinated system. Brain, bladder, pelvic floor muscles, and urinary sphincter all communicate to empty efficiently. Stress, rushing, embarrassment, or even a cold bathroom can disrupt this dialogue. Imagine trying to pour water through a lightly pinched hose. The water still flows, but not efficiently. That's what happens inside your body when tension or subtle resistance prevents full emptying. For men, slight changes around the prostate over time, even small enlargement, can create resistance, making the bladder more sensitive and prone to urgency. For women, contributors often include pelvic floor tension, posture habits, past childbirth, chronic stress, or constipation. Even with a normal exam, your bladder may not be aligned optimally. Here's the perspective shift I want you to take away. The goal is not to push harder. The goal is to create conditions that allow natural, complete emptying. Think of this as opening a door instead of pushing it. Relaxation, positioning, and timing are far more effective than brute strength. This simple 60-second routine is designed for after urination, especially at night or when you usually rush. No equipment, no medication, just awareness and precision. Step 1 is posture. Men, try sitting for a week during this routine. Sitting reduces abdominal bracing and lets the pelvic floor relax. Women, sit comfortably, focusing on alignment. Keep feet flat on the floor, knees slightly higher than hips. Lean forward lightly, resting elbows on thighs. This positions the bladder outlet for more efficient flow. Step 2 is breathing. Inhale slowly through the nose, letting the abdomen expand. Exhale longer than your inhale, relaxing shoulders, jaw, and pelvic floor. Tension in the jaw correlates with pelvic tension. Repeat once. Slow inhale, long exhale. This signals safety to your nervous system. Step 3 is the pause. When the stream stops, don't stand immediately. The bladder empties in waves. Stay seated, maintain your forward lean, and breathe normally. Count slowly to 10. No pushing, no straining. Step 4 is the gentle second release. Subtly rock your pelvis forward and back. Lean slightly forward and exhale slowly. Many people notice a second brief stream begins naturally, often eliminating that nagging sense of incomplete emptying. In under a minute, this resets your bladder, reduces residual urine, and restores confidence. Doing this before bed often improves sleep and reduces nighttime trips. Even the best routine is more effective when you address small habits that interfere. Constipation is one of them. The bladder and rectum share space and nerves. Chronic fullness presses on the bladder, preventing full emptying. Adjusting bowel habits often improves bladder comfort quickly. Rushing or hovering also creates tension that is subtle but powerful, so give yourself a full minute precision over speed. Breath holding increases abdominal pressure and pelvic tension, so focus on long exhales instead. And avoid just in case. Urinating without true urgency trains the bladder to signal prematurely, increasing hypersensitivity. These habits are normal, but awareness and small corrections amplify the 60-second technique dramatically. Here's what's happening in your body and mind when you apply this routine. Biologically, the forward lean aligns the bladder neck and urethra. Feet support reduces pelvic tension. The long exhale lowers sympathetic nervous system activity. The pause allows a second contraction. And the gentle pelvic movement releases trapped urine. Emotionally, confidence returns as urgency diminishes. Anxiety about sleep, travel, and social events decreases. You regain control and dignity over your body. Practically, you experience fewer nighttime trips, less rushing in daily life, and more comfort during long meetings, flights, and social gatherings. Once you understand emptying as a coordinated skill, not a strength contest, retraining the bladder becomes possible. Daily practice outside the bathroom, including slow breathing, relaxation, and gentle pelvic awareness, teaches your body that release is safe. Here's the checklist for the 60-second technique. Feet supported, gentle forward, lean, 2 long exhales, stream ends don't rush, count to 10, subtle pelvic rock, 1 more long exhale, then stand calmly. Remember, the pause is the most powerful step. Practice it daily. This routine works well for mild to moderate symptoms. Seek medical care if you notice pain, burning, or fever, blood in urine, rapidly worsening urgency, or a weak stream or inability to urinate. Your bladder is not betraying you, it's communicating. Respond with calm technique, not force, and the conversation changes. Try the routine tonight just once. Notice subtle improvements. Over days, comfort, sleep, and confidence often increase. I'm Dr. Jocelyn, and here's the take-home message. Complete emptying is often a skill of relaxation and timing, not strength. And skills can be learned at any age. Comment below with your experience. Like this video if it helped. Subscribe for more science-backed strategies to protect comfort, confidence, and dignity. And share this with someone struggling quietly, they'll thank you. Your bladder doesn't control your life, you do. With awareness, small adjustments, and this simple 60-second routine, you can sleep better, feel more confident, and reclaim control over your day.